Hello again and welcome back to our talk. We're talking about slowing down the process of aging and disease. Dr. James Meschino is with us. The big question, is it ever too late, and at what point?
Yeah, you can leave it too late. I mean, if you have final stage disease, whether it's Alzheimer's or cancer, you've had 10 osteoporotic fractures, it's too late. The idea is most people are not at that stage, fortunately. So wherever they are before that stage can make a significant difference. I mean, a highly significant difference to their risk of developing degenerative illnesses. I don't think people realize the impact that diet and lifestyle factors have on these conditions.
You were telling me something quite alarming in the break. Now, you mentioned it in the first part of the program about the cancer and what you eat link. People tend to think of lung cancer coming from smoking, even marijuana, that kind of a thing, but what you eat has a lot to do with it, more so than people realize. Yeah, can you expand a bit?
Yeah, it's an accepted conversation. If I say to you that 87% of all the people that get lung cancer are cigarette smokers, people go, yeah, you know, people should quit smoking.
And they easily accept it.
And that's established, and people who smoke know the risk. But I don't think people realize that 35 to 40% of all cancers are directly linked to faulty dietary behaviors, and that most of heart disease is linked to faulty dietary behaviors, and that almost all of osteoporosis is linked to faulty dietary behaviors. So those conditions, heart disease, osteoporosis, a high percentage of cancers that are linked to diet, diet impacts those things in a way that's as significant as cigarette smoking does to lung cancer. And I don't think that's appreciated. When I talk to large groups and do seminars and show them how these dietary factors affect these diseases, for most people it's the first time they've ever seen it.
Yes.
And it changes them when they understand the mechanism of action through which it occurs.
Now, for a person who is in the early stages of deteriorating health, how big a difference will this make to make that sudden radical change in diet?
Well, anybody over the age of 25 is actually biologically starting to show deterioration. So the further along you are, the greater can be the comeback, of course. So, you know, often people become interested in diet and supplements and exercise once they're 30, 35, 40, 45, 50 years old. When they start to feel like their body is not what it used to be. That's when they start to become more interested, or a close friend develops a condition, or they see something runs in their family, they're afraid of it. And so not only does it change how you feel, but what I'm interested in is, you know, how can we really measure what your risk is of future illness? And so that's why I like to get the people that I speak to go to naturalhealthtest.com. Fill out the 173 questions that are there, and it's complimentary, there's no charge for it. They fill it out, and then we send them back a feedback report that says, if I were you, based on what we're learning about you, these are the dietary changes that make sense, these are the exercise parameters you should work within, these are the nutritional supplement ingredients and dosages that are appropriate for you, and these are things you should never do because you're on certain medications or you have a certain health condition that would preclude you from ever doing certain things. But then after that, I send them back an email report that says, and these are the blood tests and medical investigations that are really appropriate for you. And here is the ideal range, not the medically accepted range, because, you know, medicine says that if your cholesterol level is 5.2 millimoles per liter, that's acceptable. And yet people have heart attacks at 5.2. But the Framingham Heart Study, for instance, the largest heart study ever undertaken, shows that people that have a blood cholesterol level below 3.9 millimoles per liter, which is below 150 milligrams per deciliter, never have a heart attack. So for me, the optimal range for your blood cholesterol, as an example, is not 5.2, it's under 3.9. So I send people back a report that says, these are the range I want to see you in for optimal health to maximize your defense against these major degenerative illnesses. And so it's not just about how you feel, but there are absolute objective measurements that we can send back to you that would help you identify where your overall health risk profile is.
Wow. Now we're going to have to go for a break, Dr. Meschino, but two questions I want to ask you when we get back. is it possible to reverse the process of these diseases once it's begun? And the other one, what about cheating? Some people say you can cheat and have a few snacks once in a while. How do you do that? We'll be back after this. Stay tuned.